Thank you for having me. We'll be discussing the signs of breast cancer tonight, and I'm Anne Friedrich, and I work for Bay State Health, and I am assistant professor at surgery at the UMass Chan Medical School. And so first of all, I think it's important to understand what breast cancer actually is. And in the US, it is the most common type of cancer among females. In fact, 1 in 8 women will develop breast cancer in their lifetime, which is an overall lifetime risk of 12%. And it's becoming more frequent. We diagnose it more often. So what does this mean? When we look at all new cancer in the United States, and these are the 2022 estimates, we can see here that breast cancer is the most common type of cancer diagnosed among women. And 31% of all new cancer diagnoses are breast cancer. And this is followed by lung cancer with 13%, and then colorectal cancer with 8%. Whereas in men, of course, it's not breast, it's prostate cancer. However, when we look at the second line here, we see that breast cancer is not responsible for the majority of cancer deaths. It's only responsible for 15% of cancer deaths. So it's important when you look at these numbers here to understand that this doesn't mean that 15% half of all people that get breast cancer die from it. It means that 15% of all cancer deaths are due to breast cancer. So lung cancer, even though it's only the second most common type of cancer, is in fact the most common reason of cancer death. And when you look at the numbers here, 287,000 women will get breast cancer in 2022, and 43,000 will die from it. So this is not half. And in fact, the risk of death from breast cancer has gone down over the most recent years. You can see the breast cancer line here. This is the rate per 100,000 female patients, rate of death. And it's been pretty stable throughout the 30s, 40s, 50s, 60s, 70s. And then here it goes down. And why do we think that is? There's multiple factors that have contributed to this decrease in breast cancer mortality. One part is because we know more about it, and a lot of awareness public attempts have helped make the public more aware, and people know that breast cancer exists and that it's common and that it's a risk. So people look out for themselves and are more aware of the fact that they could get it. And we're also better at finding it. You can see here that this is basically when screening resumed. And ever since then, breast cancer deaths have gone down. We're finding it earlier, and we're finding it more often, and we're able to treat it earlier at earlier stages. And the treatment has gotten better too. We're better at treating it. Overall, we've become more nuanced in the way that breast cancer is treated, and we know better which ones need surgery first and which ones need medical therapy first. And we do the things that we know prolong survival. So since 1989, an estimated 431,000 deaths have been prevented by increased awareness, by improved screening, and by improved treatment, which is great news. So how do we find breast cancer? Most commonly, actually, we see it on mammography or on ultrasound. These imaging modalities have the option of discovering lesions that are too small to be felt or make any symptoms. And they can even discover non-invasive breast cancer, stage 0 breast cancer, before it becomes invasive. Which leads me to the main part of this talk, the signs and symptoms of breast cancer. So it's really important to know that the most common symptom is no symptom at all. Most breast cancer does not cause any symptoms. But the ones that do cause symptoms, what are those? What are the signs to look out for? The most common and most obvious one is a mass or a lump in the breast. And these are usually new masses and new lumps. It can be really hard to evaluate breast tissue because a lot of breasts are naturally lumpy, bumpy. Masses or lumps in the breast can be large or small. They can be very deep in the breast or very superficial right underneath the skin. They can be mobile within the breast, or they can be fixed to the skin or to the chest wall. They can be hard or soft. And like I said, because of the breast tissue often being nodular and lumpy, it's important to know what the baseline of the breast tissue is like and what it feels all over so that one can notice a new mass that is different or new. When you're in doubt about masses in your breast or lumps and what is normal and what isn't, it's a good idea to start with a professional breast exam. And those can be done by breast surgeons or other breast doctors or OBGYNs or primary care physicians. Other signs of breast cancer. Asymmetry, especially when it's new. All of a sudden a breast becomes large and swollen, that might be a sign of breast cancer. All of a sudden there's a new change, the skin looks different, the breast falls different, the nipple changes, it can become flattened or retracted. Masses can be visible with a straight eye. The skin can retract or start dimpling. Or the skin can change. And we'll talk about skin changes a little bit now. Some of the most important skin changes to look out for are skin thickening, and that can be of the complete skin of the breast or just part of the breast. The skin can become red. And it's important to know that the most common cause of breast redness is actually mastitis, an infection of the breast that can happen during lactation when we breastfeed our children. However, redness of the skin outside of lactation and outside of a clear infection is concerning. How do we differentiate that? Well, redness that's infectious often goes along with pain and fever. Redness that's cancer-related often does not cause any pain or fever. And it doesn't improve with antibiotics. So any time that breast skin becomes red, that's a reason to go to a doctor to differentiate between the two. Breast swelling, like I mentioned, is an important sign to look out for. Sometimes cancer can be diffuse all over the breast, and the breast can become swollen and large all of a sudden. A famous presentation for breast cancer is inflammatory cancer, and that often presents with a so-called orange peel appearance of the skin. It has these little indentations, almost looks like looking at an orange, and the breast will classically be red. That can happen when cancer has reached the lymphatic vessels in the skin and is blocking the lymphatic flow, leading to this orange peel appearance. Other skin signs that could be a sign of breast cancer are wounds, especially new wounds or wounds without history of an injury, and wounds that don't heal. Nipple changes, like I mentioned, can be varied. There can be asymmetry of the nipple. The nipple can be retracted or flattened all of a sudden, or there can be scaliness of the skin around the nipple. Sometimes these nipple changes are chronic, in which case it's nothing to worry about. If a nipple has always been retracted, that is probably normal. Sometimes the skin just does things like become dry, and that can be normal. But persistent changes or new changes are a sign for concern and a reason to reach out to a healthcare provider. Nipple discharge can be a sign of breast cancer as well. And again, it's important to differentiate normal and abnormal nipple discharge. Of course, the primary reason why people have breasts is for breastfeeding, and the nipple was meant to provide breast milk. So a normal type of nipple discharge is lactation, which is milky discharge in the postpartum setting. Sometimes this can also be a sign of a different disease that's not related to breast cancer, but it's very normal and someone has had a child to have milky nipple discharge. Then there's nipple discharge that can either be normal or abnormal, and that includes discharge with manipulation. When squeezing or manipulating breasts or nipples, sometimes there can be discharge. This can be normal discharge or abnormal discharge. Green or brown color is most often related to fibrocystic disease, which is not a reason for concern. But types of nipple discharge that are concerning for cancer are when it's spontaneous, when it comes from only one breast, and when it's clear or bloody in color. Those are absolutely signs to reach out. And they don't have to be a definite cancer sign. They can be, they're concerning and they require workup. But there can be benign reasons why a nipple discharge would happen as well. And then there are very rare signs of breast cancer. For instance, pain in the breast or pain in the armpit. It's important to know that breast pain is very common. The breast tissue is sensitive, especially when there's hormonal changes. So oftentimes breasts become tender with a cycle. Some breasts are tender because of underlying muscle spasms, and some breasts are tender and we don't really know why. So breast pain is very, very common. It's very, very uncommon for a cancer to be the reason of that pain, but it's not completely impossible. In rare cases, breast cancer can cause breast pain. Similarly, swelling or pain in the armpit can be a sign of breast cancer. Why is that? So the armpit contains lymph nodes, and sometimes cancer can travel to the lymph nodes and make these lymph nodes enlarge. Now, this isn't the most common reason why lymph nodes get bigger. Usually they get bigger with infections or sometimes when we react to vaccines. So most commonly, when people have swelling or pain in the armpits, the reason for that is not breast cancer, but it could be. Lastly, there are signs of advanced disease. And by that, I mean breast cancer that has spread outside the breast and outside the armpit and is now somewhere else in the body and has set up metastatic sites. So these can cause symptoms too. For instance, if there is metastatic disease in the brain, this can lead to seizures or neurologic dysfunction. If there is metastatic disease in the bone, it can cause severe bone pain, or people can even break their bones without falling. That's called a spontaneous fracture. If breast cancer lives in the lung, it can cause shortness of breath, coughing, or wheezing that's new. And sometimes when cancer is all over in the body, it can cause weight loss that's unexplained otherwise. Again, these are rare ways to present for breast cancer, but they're not impossible. So what do you need to do when you notice any symptoms that are concerning? Usually a first good step is to talk to your primary care provider or to your OB/GYN, and then to get evaluated, get a professional breast examination, and have imaging done if needed. And imaging can be done for younger and older women, for women who've been up to date with their mammogram, and for women who haven't. And when in doubt, you can come see us at the breast center. Our Bay State Breast Specialists, these are the surgical and clinical providers, is located at Wasson Avenue in Springfield. And the phone number is here. You can choose option 2 to schedule an appointment. If you'd like to start with your mammogram, because you're just realizing that you do, you might want to start by calling the breast radiology department. And you can even schedule your mammogram online. Same address, but there are additional sites for our radiology team throughout Western Mass and Connecticut. And even the breast specialists go to multiple locations now, and you might find one close to your home. So remember, most breast cancer does not cause any symptoms. It is really important to not forget your mammogram and to get that done first, because that is still how we discover most breast cancer. And now at this point, I'll be happy to take any questions.
Thank you, Dr. Friedrich. That was great. And a lot of things I didn't know about for signs and symptoms. So well done.
This is our team, by the way, here at the breast center. And there's another big team from the radiology department that will be happy to assist with the mammograms.
Wow. That's quite a crowd there. They look beautiful. It must have been difficult to get them all for that photo, too.
I'm sure we're missing about 5 or 6.
Oh, my goodness. Well done. So we open it up to Q&A. If anybody has any questions, they can type it in the Q&A box and we'll moderate those. I did have someone who emailed me a question in advance of the event. And she wanted to know what your recommendations were for women with dense breasts.
Yes. So dense breast means that the breast tissue is a little bit harder to evaluate on mammogram. And there are ways to help women with dense breasts still get a good evaluation. A couple of these include additional use of ultrasound. So often women with dense or very dense breasts will have the recommendation for a whole breast ultrasound to assist with screening. And the use of 3D mammography can be very helpful in evaluating dense breast tissue as well. Sometimes when someone has a family history that's very significant for breast cancer, or even a genetic mutation, it can be helpful to get MRI screening. And for that, I would recommend a visit in our high-risk clinic to see if you would qualify, or to talk to your OBGYN provider to learn more about that. That's a very good question.
Marianne would like to know, how about itching within the breast?
Itching, it's very rare for that to be breast cancer related. It's not impossible, but usually itching tends to be more due to other kind of skin issues than breast tissue issues, which tends to be a level deeper.
Next question, how often should we do self-exams?
So that's also a very debatable question, because there are a lot of people who actually recommend against self-exams. We as breast surgeons see a lot of patients that do feel their own cancer themselves. So I'm not comfortable saying don't do it. In fact, I think it's important to do it so that you know what is normal for yourself. I wouldn't do it more than once a month, and I wouldn't worry too much about it. It can be helpful to time it at the same time of the cycle, so that the breast tissue always is at the same stage and isn't larger or smaller. But there's no official recommendation that says this many times starting at this age. So a lot of my patients like doing it under the shower, for instance, during menstruation. And that seems to be a good way to get to know your body and your breast tissue and feel what's normal.
That's great. Thank you. That was actually the next question. Should someone lie down or do a breast exam, a self-exam in the shower?
It can be helpful standing up or lying down. I think usually standing up is a good way, especially if you move the arm up when examining the breast tissue. The upper parts of the breast can be best examined with the arms hanging down. And then the lower parts and the parts in the outer part of the body can be better examined with the arm raised.
Thank you. And has the start time or date or age for mammograms been adjusted, or is it still consistent with is it 40?
So for most people, it will be 40, or at least between the years of 35 to 45. Some people get their mammogram, a baseline mammogram, earlier. Some people will start screening later than 40 when they have no risk factors. The best recommendation is to talk to your primary care and look at your family history and personal risk factors to decide if you should start sooner than 40.
If someone has dense breasts, do you recommend more MRIs and so forth for the breast diagnose?
No, not just for the density. I think a good way of evaluating dense breasts is 3D mammography plus minus ultrasound. MRI can be very helpful for certain patients who are very high risk. Just having dense breast tissue, I don't think qualifies for that. But there may be selected cases in where the radiologists would still recommend it. But for the normal patient with dense breast tissue, I wouldn't recommend an MRI.
Cindy would like to know if you've already had a lumpectomy and radiation, are there symptoms to be aware of in case of a recurrence of breast cancer?
Symptoms are basically the same for patients who've already had treatment and patients that haven't. Of course, once you've had treatment and you've had lumpectomy and radiation, the breast might have changed from what it felt like before. So it's then important to get to know the new breast after treatment. What does it feel like and what is normal? And oftentimes, things such as scars that develop can be confusing, especially when you feel a change. So when in doubt, the survivorship clinics should be a really good first checkpoint to get evaluated and to get additional imaging done.
Excellent. Thank you.
And for patients who've had radiation, new things to report are also red spots on the skin, new red lesions. That is also something to let us know about.
And Amanda says, thank you very much. So thank you, Dr. Friedrich, for your signs and symptoms talk and for answering questions tonight. We really appreciate your time and expertise.
Well, thank you all for attending and for the excellent questions after the presentation.